We just learned what arthritis is and the fact that there are many different kinds, but where do people who have arthritis go for support? Well, they go to Tony Ward in the central region of the Florida chapter of the Arthritis Foundation. Tony is with that chapter. Thanks for being with us.
Absolutely.
What does the Arthritis Foundation actually do for people who...
Well, like you said, we do try to provide support. We try to connect people, most importantly. Here in Central Florida, there's a lot of younger people, all ages with arthritis, that don't naturally see each other. So we have fundraising events, we have connect days, just so that they can meet each other, to provide a community within the community here in Orlando.
Now, you said younger people, and that immediately, how young are we talking about?
People of all ages get arthritis. It's kind of a misnomer, if you will. Most people think it's only elderly people, but we have families from 3 years old all the way up. And 50% of the amount of people in the United States that have arthritis, which is 46 million, 50% of that is under 50. So it's actually a larger number than most people think.
So you don't hear them talk about it, I imagine, as much as older people do, who say, oh, my arthritis is kicking up. You don't tend to find younger people saying that. So what kinds of support do you give for them? Because I'm sure they don't want to share with their teenage friends or their young friends, yeah, I have arthritis.
Well, interestingly enough, a lot of the kids with arthritis, they get diagnosed a little bit later than people with arthritis, because out of the whole United States, there's 300,000 kids with arthritis. And the Pediatric Rheumatologist, which is the doctor that specifically studies arthritis in children, there's not very many of them. Here in Florida, we have about 4. Some states don't even have any. It's like a national shortage. And
we are going to talk to one of the state's pediatric rheumatologists during this show, so make sure you stick around.
Oh, absolutely.
Yeah.
Absolutely. And I will have to say that some doctors send the kids to psychiatrists, saying that the pain is in their head. Some think that it's just a sport injury, and sometimes it takes many, many times for them to come back to figure out that it's arthritis. But because of awareness of shows like this, telling people that kids get arthritis and they can get it at a very young age, it helps to get kids diagnosed earlier.
The adults who get arthritis, what kinds of questions do they have about what they'll be able to do in the future? Because I imagine if someone's in their mid to late 20s to maybe early 40s, they start thinking, is this going to be debilitating for me?
And often it is. Often it is. And the Arthritis Foundation per se doesn't hand out medical advice. We do hook them up with doctors if they call us with questions, or if they call us saying, I think I have this. We can hand out educational flyers. We have different self-help instructing groups. We have Tai Chi, pool therapy, things like that, connect days. But we don't really do very much with the medical diagnosis or speaking about it. But when they do start to ask questions, that's usually when they start asking them to their primary care physician, who will then go ahead and turn them over to a rheumatologist. But it will sometimes be very debilitating, so it really can change your life. Fortunately, now we have better medicines than we did in the past.
And you provide the support system that those folks need. Now, you told me something very interesting before we started taping, that you have created a person out of arthritis.
Absolutely.
And he actually has a Facebook fan page. Tell us about that.
He does. Well, you know, one of the very first events I went to for the Arthritis Foundation was one of those Connect Days. And there was this little old lady over there just talking about Arthur and how much he was doing a job on her legs. And come to find out, people with arthritis, especially the elderly, they call him Arthur. So if you're on Facebook, you can actually go to Arthritis. And Arthritis is a Facebook page, and we communicate with some of our mothers and families through there. We post events. So it's just one more fun way to kind of make arthritis a little more exciting. Everybody hears arthritis, they think it's about older people.
Okay, and another way for you to connect.
Absolutely.
People. Tony,
right
thank you.
Through the internet. Thank you.
Thank you for all the work you do to keep people connected and to help them know they don't have to hide in the shadows.
Wonderful. We invite everybody to call us and connect with us, and we do want to remind them that the events that we have, all the money that we raise, we're the largest private nonprofit funder of research for arthritis. So when you come to the Arthritis Foundation events, you not only help the families directly with Connect programs, you're helping to find a cure and better medication. So thank you.
Well, I think that we need to let that be the last word, a great last word. Thanks, Tony Ward.
Thank you, Annetta.
When we come back, we're going to find out about research and developments in juvenile arthritis.